All right, here we go. So I'm going to bring up our presentation for today. Okay. All right, so our job for today is, as I explained, what we've been going through the last couple of weeks is the issue of mental illness and well-being across the different cultures. And we started with defining how mental illness and mental health is defined within the Western cultural perspective. And so now what we're going to do is look at it from a cross-cultural perspective. And we're going to see that differentiation between what is known here in the United States and parts of Europe as what would be considered mental illnesses may not be considered that much as far as other cultures are concerned. And so today's goal is to see what the variation in what people consider as normal behavior or behavior that is maybe of concern, but maybe concerned not within the illness domain, but maybe within the social or human domain, and therefore demand different types of responses based on the culture that the person is in. So that's kind of our goal for today. So we're going to start with um, again, some cross-cultural perspectives on mental illness. Let's begin with a definition just to kind of remind us. Mental illness are health conditions involving changes in emotions, thinking, and behavior, often associated with some type of distress or impairment of function. And if you remember, when we went to the Western definition of mental illness, this impairment of function is usually the driving force to determine whether or not someone needs treatment for a mental illness or not. If a person isn't able to hold down a job or finish their education, or they have maladaptive issues with social relationships, they might have maladaptiveness with sleep and wake cycles. Those are all impairments to a person's ability to function normally within a cultural domain. So that's going to be the major factor that we're going to look at when we look at mental illnesses across different cultural perspectives. Okay. So when we talk about global prevalence, we do need to note that mental illness affects all cultures, just like physical illness, like diabetes, cardiac issues, all of those different physical ailments. Mental illness affects just as much. Okay. But rates and recognitions vary significantly. So, just like, again, I'm going to say this with physical illness, here in the United States, we see higher rates of things like obesity, things like diabetes, things such as heart disease, when we compare ourselves to some more Eastern cultures. Okay. Just in that same kind of area, mental illnesses, we see different variations based on the culture that the person lives in. So that's something to kind of keep in mind, saying that because the idea that it doesn't exist is not right, because mental health and mental illness have a close relationship, just like physical health and physical diseases have a close relationships. And in some cultures, they're able to manage them better through mental health before it becomes an illness. And that's kind of going to be kind of the theme that we're going to see. Okay. We also need to note the cultural impact by different ways we frame or diagnose a disorder. So in Western culture, we emphasize on individual symptoms. So we diagnose much like we do with physical health through the DSM or ICD-11 are widely used, where we look at very specific symptoms of the individual. But what we'll see is some non-Western cultures, symptoms may be expressed as somatically, meaning that in some non-Western cultures, depression symptoms are not seen as something they see within the mood of the individual, but they see through physical pain of the individual. Okay. And same with anxiety disorders or post traumatic stress disorders. They don't necessarily put them on the mental spectrum like we do with the DSM or the ICD. They put it more on the emotional spectrum, on the physical pain spectrum, excuse me. And we do need to recognize that in a lot of non-Western cultures, mental illness may be stigmatized or linked to a spiritual belief. And so we do see with some cultures that are especially second or third world in belief systems that they still hold that idea that of the moral corruption theory that we talked about, that it's something to do with a moral deficiency within the individual. That's why they're experiencing the symptoms that they do. Now, we do need to recognize that when we say Western and non-Western cultures, those lines are very thin, because even within our Western culture, we still see this idea that bringing people closer to Jesus will fix their mental illness. Bringing people closer to the religion and the spiritual belief will fix the person's illness in some way. So I don't want to make this line between Western and non-Western cultures as this line of definity, that only in non-Western cultures do they still see that spiritual belief and moral deficiency is the cause of mental illness. It's just that more pronounced. It's that much more believed in, according to the analysis that we have. Okay. And we should recognize, even in a study of 2023, studies highlight the stigma and cultural perception significantly influence the help seeking behavior of individuals, especially those who are diagnosed in, for example, Asia, Africa, and Latin America countries, where that stigma of it's a moral deficiency is much stronger than it is in the more modern Western cultural perspectives. Okay. And so we do have to see that just like a lot of physical ailments like leprosy and those types of diseases, they're a curse by God. And that in some, I don't want to say different culture, but I want to say some countries who have not had more modernization, they still see it as something that is spiritual, that it's an infliction based on God's wrath, in a sense. And so kind of keep those kind of things in mind. It's not of cultural technology, it's about cultural advancement that a lot of these stigmas still exist. So when we're studying mental illnesses from a cross-cultural perspective, we also have to note that there's diagnostic challenges, okay? So for example, some cultural variability, depression often is underdiagnosed in collective cultures where emotional expression is suppressed. So in some cultures where the idea of individual emotional expression is not seen as a highly valued perspective, that the idea that you are depressed or have depression is tends to be overlooked, because you shouldn't feel that way unless you are disconnected from the social unity that is existing. Okay. And so it's seen as a stigma of the individual because they're not connecting with the community as well. Same with schizophrenia. So in some cultures, and even in Western culture, we can go back some decades ago, even close enough to Abraham Lincoln's a presidential experience, that schizophrenic symptoms, according to the Western value that we defined it as here in Western ideas, as a misattribution to spiritual or supernatural causes in some regions. So we can see this still within some areas where people who can hear voices that other people can't hear, they can see things that other people, they have delusions of grandeur. All of those things we can see that even some cultures still hold those people as not as having a mental illness, but are considered someone of some spiritual or supernatural affliction of some kind. And again, I do want to bring this back to Western values and stuff, because even Western psychology and Western mental illness, understanding of mental illnesses, still do not understand this as clearly. Hence, we can have a felon of 56 charges as president of the United States. So we can misattribute some delusional thinking by people as having some spiritual or supernatural cause, even here in the United States. We can also see some bias and diagnostic tools issues. So we can see, for example, the full use of the DSM may not account for things like cultural diversity in symptoms of expression, okay? And this comes out in some key studies. So when we look at cross-cultural studies here in Europe versus South Asia, we feel differences in how PTSD symptoms are reported, with South Asians more likely to report physical symptoms, whereas here in the European countries and the Western countries, they're more emotional symptoms. So when we talk about somatic symptoms, we're talking about physical pain. So what this suggests is that based on culture, especially in South Asia, that symptoms of post-traumatic stress disorder should be seen as a somatic disorder, meaning that it's a physical pain disorder rather than an emotional anxiety reaction disorder, okay? And in 2023, research of sub-Saharan African emphasized the role of local healers in initiating diagnosis and treatment pathways. And this is something that I think is important to state about the cultural perspective on healing and health. Because what we have found since the time where, for example, Native American and indigenous tribes here in the Americas and in the United States have been promoted to take their language back, take their nation back, take their healing back, that the idea of a healer, for example, such as such as an elder coming into the home and stating, this is what this individual needs to do to be healed, has become such an important aspect of a lot of understanding of Indigenous and Native American psychology, that we're coming to the understanding that because of the identity of individuals within Indigenous and Native American perspectives, that healing from mental illness and even physical illness needs to take in traditional ways of being, and combined with some of the more Western cognitive behavioral therapies. And we're finding that more and more often that taking in the history of individuals who their history has been suppressed, and finding that identity has increased the efficacy of treatment. And I mentioned in this class before, I believe that even with most modern treatments in the United States dealing with cognitive behavioral therapy, that we're finding, especially among Native American groups, that if you integrate the understanding of identity as being Native American and identity as healers within that culture, the efficacy, the ability to treat individuals has increased, not decreased. And we're finding the same thing with physical health within a lot of Native American communities. You all may know that diabetes has become a major concern in a lot of Native American communities. And again, what we have found is an integration of Western medicine, but inclusion of traditional eating methods, traditional ways of being within those Native communities have increased the efficacy of diabetic treatments within those communities. So what I'm trying to show here is that there's this line that culture plays a major role in our healing efforts, regardless of modern medical technologies that are not only within the mental health realm, but within the physical health realm, that all of this needs to be integrated into a holistic model that includes, for example, with diabetes, traditional ways of eating, traditional ways of being within that, plus this modern Western idea of treatment. We're finding the same thing within mental illness. Cognitive behavioral therapy within the Western domain gets us so far. Medical treatments such as medications get us so far, but the integration of traditional medicines gets us that much further. Okay, so I just want to bring this up because that 2023 study, and when we're talking sub-Saharan, these are individuals who have not really been touched by Western medicines. And we find in these locations that local healers have much more of a impact than do integrations of bringing in things like insulin or antidepressants or anything into these communities, that within these communities, because they haven't been impacted by Western medicine, that the integration of their traditional healing methods first, and then the integration of other medical advancements have been really beneficial within these communities. So again, this just brings up some of these ideas that we've been talking about approaches to treatment, such as stigma, resource disparity, limits to mental health professionals and infrastructure, and promising practices. And as I mentioned just before we started here, CBT modified to align with cultural values, as I was talking. Use of traditional practices in conjunction with modern treatment tend to be the best advantageous types of treatments that we should look for. Global initiatives, some global initiatives include things such as the WHO's Foundation, the Mental Health Gap Action Program, expanding access to mental health care in underserved regions, and collaborative efforts to train local practitioners in culturally informed practices, and making sure that the culture is a driving force behind the treatment of individuals within that subset of communities. And in conclusion, we need to address cultural nuances in diagnosis and treatment and critically provide equitable and effective mental health care across cultures, okay? And so I want to bring up some kind of differences that we have mentioned throughout this classes about differences among Western and non-Western cultures, okay? So we haven't really defined ADHD. It's a neurodevelopmental disorder characterized by inattentive hyperactivity and impulsive behavior. Okay. When we measure this, where we can measure this across global cultures, ADHD affects about 5 to 7% of children worldwide. though rates vary due to culture, diagnosis, and methodology differences. And that's an important thing to state. Because when we look at ADHD treatment in Western culture, we take very much the medical perspective that and we see a higher diagnosis rate due to the establishment of DSM and ICD symptomology. And let me kind of explain this and kind of bring this to light. So in the United States and within Western cultures, especially within England and more European countries, Great Britain, diagnosis rates are largely established by the formal structural systems in place, meaning the education systems. And so the largest diagnosis rates that we see here in Western cultures, especially here in the United States, tend to be in the of children who are born in the month of August and September. Reason being is those are the cutoff dates for entry into kindergarten or first grade or whatnot. And so they tend to be the most immature population within the classroom. And if you think about children who are more immature than their peers, they tend to be more inattentive, hyperactive, and impulsive. And so teachers instantly see those children as having the symptomology of a child who has ADHD. Okay. And so we see within our culture, because of the way we diagnose ADHD, that there tends to be higher rates within our culture. However, within non-Western culture, there's lower diagnosis rates because symptoms are often attributed to behavior or environmental factors, such as the things that we don't take into account here in our Western culture, such as the child is younger than their peers, such as the idea that the environment is an influential marker to determine how the child is going to behave based on that child's developmental age. So where we base in Western culture the diagnosis on behavior in and of itself, in non-Western cultures, they have lower diagnosis rates because they take those environmental factors and where the child is developmentally into effect. I shouldn't say into practice, but into effect. So some challenges: stigma, lack of resources, differing culture norms regarding children's behavior largely influence whether or not we are diagnosing a correct case of ADHD, which I would argue in our Western cultures, we overdiagnose for ADHD. But I would also argue in non-Western cultures, they're probably underdiagnosing because they're seeing those things as something due to the behavioral environmental factor, and they're not taking into consideration the individual child's symptomology. So those are all things to consider. In one, we may be overdiagnosing, and another, we may be underdiagnosing due to our cultural understanding of the disorder in and of itself. So some recent cross-cultural studies have found, so for example, in 2023, a comparative study found a significant difference between US and China and Brazil. In South Korea, parental perceptions heavily influence diagnosis, often delaying treatment due to stigma that it would put on the child. Some African studies emphasize the role of social economic factors in underdiagnosis, that it's only the poor, it's because a child comes from an impoverished setting. That's the reason that they are being hyperactive or inattentive, is because they're looking for that next resource, which has some validity to it when we look at the reassessment of things like the marshmallow impulsivity studies here in Western culture. Cultural biases in tools. Western developed diagnosis tool may not align with cultural norms, such as individual and collectiveness. So some recent efforts in improving the diagnosis of ADHD is to try and improve the sensitivity of tools based on the culture in which they're being used. And then treatment approaches. Again, here in our Western culture, it's more of a pharmaceutical, medical type of treatment. And whereas in other cultures, behavioral therapy which are increasing globally adopted type of treatments. So the way that we're approaching the treatment of this disorder also has an influence on the diagnosis rates and the prevalence rates. So implications for global practices, key challenges. Balance universal criteria with cultural sensitive practices. That's one thing that we should take in consideration. Development of cultural adaptive diagnosis framework. And in conclusion to this idea on ADHD is a cross-cultural understanding of ADHD is vital in improving diagnosis and treatment. Because as I stated, in one culture, in our Western culture, we're probably over-diagnosing. Whereas in other cultures, based on the criteria that we use, we may be under-diagnosing. And so balancing the idea of cultural understanding with the tools that we're using is becoming more and more vital to the development of our understanding across humans, regardless of cultures, of disorders. And the last example we can use as a cross-cultural perspective is issues such as autism spectrum disorder. So ASD, which is defined as a neurodevelopmental condition that is a challenge in social interaction, communication, and restricted or repetitive behavior, okay? Global prevalence ASD occurs worldwide with variation in diagnosis rates due to culture, diagnosis, and methodology, okay? We do see here in the Western culture high awareness, and therefore it leads to higher diagnosis. We see in non-cultural, non-Western culture diagnosis often is delayed or overlooked due to stigma or lack of resources, okay? Role of cultural norms, symptoms may be interpreted differently, influenced on diagnosis rates, social withdrawal. So for example, social withdrawal within collective cultures are not seen as necessarily a disordered behavior, but it can be seen as a social behavior that needs to be corrected or understood. Okay. And this is a thing that a lot of people don't understand about ASD is autism is a communication disorder. The behaviors we see within the stemming and the need for consistency, all of those things are side effects of the social interaction that the person has to go through. And so once we understand autism as a social disorder rather than a symptomology disorder, it kind of brings to light how cultures may view it differently based on the role they take, whether a collective society versus an individualistic society. So some key findings when it comes to ASD. 2023 highlights significant underdiagnosis, especially within low-income countries, due to limited access to healthcare. High rates of early diagnosis is, of course, occurring within Western countries due to public awareness campaigns. And I do want to make this point, and I think it's a very important point to make at this time. Our very non-expert expert in health and human services, who does not have a degree in mental health, does not have a degree dealing with anything with physical health, has listed ASD as a pandemic here in the United States and is a public health issue here in the United States. I'm just going to put this out there. This idiot is hitting a lot of alarms that should not be hit. The increased diagnosis rates of ASD are due to our refinement and understanding of autism and it as a disorder. It is not because we're seeing increased rates of autism. It's due to increased awareness of the symptomology. If you look at ASD specifically within teens and young adults, all of those individuals 20, 25 years ago would have been diagnosed with schizophrenia because autism was seen as a childhood disorder, not as a young adult disorder. Many children in 20, 25 years ago would have been diagnosed with either schizophrenia or with Asperger's disorder. But due to the refined definition of autism and our understanding of it, is the increase in diagnosis, not what that idiot's trying to do on our federal level. So I just want to put that warning out there as you look at autism. But let's look at diagnostic tools and bias. So they often lack cultural sensitivity, and they can lead to potential misdiagnosis or missed cases. Hence, that's what we saw 25 years ago here in the United States, is a misdiagnosis, assuming that it was something like schizophrenia or something like that, instead of seeing it as the disorder which it should be properly diagnosed as. Okay, so to put this into perspective, there's a growing evidence that autism shouldn't even be seen as a disorder, because we're seeing that the majority of people with autism actually have a very functional and purposeful place within their cultural context that they add value to, not distract from. Remember that an illness is supposed to be limiting a person's potential. But when it comes to ASD, we find, yes, it limits according to our cultural definition of what the disorder is, but we're actually finding that these individuals with these kind of disorders are actually adding more and more value. And this becomes what's called the neurodiversity argument, that people with ASD and even within ADHD have a purpose within our culture. And so should we be treating it, or should we be promoting their abilities within our cultural context? And that's something that I think as a culture that we still have a lot of area that we have to grapple with and we have to understand. So just kind of summarizing this up, there is a lot of stigma behind it, disability versus whether it's a value trait, resource availability. We also need to understand that there needs to be cultural tailored interventions and community-based support, and bridge cultural gaps in diagnosis and treatment is essential to equitable care. Okay. And so those are all things that in cross-cultural perspective that individuals are working on, is regardless of culture, what is it that we define as ASD, despite what the cultural value that is being placed on it is. Okay. And I just want to wrap up our class with this. So this last part was on happiness and well-being, and how much does culture play in our measurement of whether we're happy or we're sad. And I'm going to bring this up cross-culturally. The Nordic countries, we're talking Norway, Finland, those countries tend to measure higher on happiness and well-being compared to other cultures. Some Mediterranean countries measure higher, and they tend to have these cultural elements in place that are listed here. One is economic stability. So wealthier nations report higher happiness due to access to resource and securities. But I want to stabilize this. So what is the difference between, for example, Nordic countries versus here in the United States, which is reported as one of the wealthiest countries in the world, is that economic stability is felt throughout the Nordic countries. That a person making $20,000 a year versus a person making $1 million a year both feel stable and economically secure in Nordic countries. Whereas you could probably guess here in the United States, there's a big gap between feeding your family on $20,000 versus $1 million a year here in the United States. Hence, we see a huge gap in this idea of wealthier nations. Okay. Social support, strong families, and community ties boost well-being. And that's especially true in collective cultures where we see, for example, in our more Eastern countries, Japan, Thailand, the Southern Eastern Asian countries, we see people living healthier and happier well into later ages because they maintain those social connections and those social ties much stronger than we do in our more individualistic countries. And freedom and autonomy, personal choice and freedom to drive happiness does drive those in individualistic societies. And cultural norms, the idea about bringing people to a sense of belonging, such as having a common tie to a religious belief or traditional beliefs or values based on family ties, tend to drive happiness and well-being through cultural levels. So, for example, again, I'll bring up again the reason why I compare United States to other wealthier advanced countries is the United States tends to measure low on happiness and well-being, despite being a highly wealthy country and boasting freedom and autonomy. But our cultural ties are very loose. We don't have traditions that really tie us together, and they're loosening more and more. We also see the loosening of strong family and community ties, where communities are something of the past, where children are not necessarily raised and born and grown in the same community. And the ability to create economic stability tends to be loosening much, much more here in the United States. And so I'm going to conclude with this, Mark, and this idea is that the United States as a culture, I think, has potential, but I think it's going through its own growth cycle as far as bringing a culture together with its own uniqueness. I'm just going to put that out there as far as cultural growth is concerned, because the United States, while we do have our native and indigenous communities that have been here for thousands and thousands of years, which we should grow and learn from as this uprooted culture. It's only 400 or 500 years old, and it has a long way to go as far as happiness and well-being are concerned. And I'm just going to state that as far as where we should head culturally. So I already explained all of those things, so I'm gonna stop my recording. Let me stop sharing, and I'm gonna stop the